Efficacy and safety of Landiolol, Professor Michel Slama, Chairman of Critical Care Medicine, Amiens University Hospital, France.
Let me show you this study, the GLAND-3S study, which was a multicentric open-label randomized controlled trial comparing Landiolol and control group. And look at that. First, the heart rate decreased much more with Landiolol, but the main finding of the study is that using the Landiolol, it was possible to reduce the new incidence of the new onset of the atrial fibrillation dramatically. And regarding the mortality, it was lower with the beta blockers, with the Landiolol, but it was not statistically significant. Now, of course, we would like to have a drug with a good safety, not only good efficacy, but a good safety. And if you look at that, the comparison during this study between Landiolol and control, you have exactly the same number of patients with adverse effect. With Bruno Levy, we published this paper because we would like to check the effect of the Landiolol in a new onset of atrial fibrillation in non-surgical ICU settings. And you see that in this systematic review, so we found that the sinus rhythm was, the patient was converted to sinus rhythm after using Landiolol in 50 to 100% of cases. Why? Is maybe because due to the pharmacological effect of the Landiolol. If you look at this comparison between 4 different beta blockers, esmolol, atenolol, and metoprolol, you see that the onset of the effect is 1 minute for the Landiolol. You see that for the half-life is only 4 minutes, which is very important. Because when you start with a low dose of Landiolol and you increase the dose, your infusion, and you, for example, you have any adverse effect, a decrease of mean arterial pressure or lower too much the heart rate, so you have to stop, and a few minutes later, so you go back to the previous situation. So it means that having a very short half-life is very important for us in ICU when we are dealing with patients with septic shock, high dose of noradrenaline, and then we really would like to be safe. And if you look now at the duration effect, it's 15 minutes, and at the end, the ratio between beta-1 and beta-2, so you see that it is 255, much higher than the esmolol. And in an animal study, it was compared with the esmolol by increasing slowly the infusion dose. And if you look at the red on left-hand side, left was Landiolol, red was Landiolol, and in black was esmolol, you see that both may change the heart rate, but the Landiolol, even high dose at 10 milligrams per kilogram, so did not change the mean arterial pressure despite, and we know that after the paper of Bruno Levy, that the esmolol may drop the mean arterial pressure when you increase the dose. That's why the guidelines from the European Society of Cardiology stated that in ICU patient, so you know that a spontaneous restoration of the sinus rhythm is high in the first 48 hours, but if the patient is crushing, of course you have to do emergency electrical cardiovascular, but as I told you previously, high rate of immediate relapse, and then you have to use treatment drugs like amiodarone or beta blockers, which were similarly effective in a big study in United States and United Kingdom. And they stated that the amiodarone and beta blockers are superior to digoxin and to calcium channel blockers. And what they said as well is Landiolol is safe even in patients with a low ejection fraction.